So, good afternoon, everyone. Thank you very much for being here. We're going to get started. I want to thank you all in person and online for being here. My name is Ken Goodman. I direct our Institute for Bioethics and Health Policy at the Miller School of Medicine, and it is a privilege to have you here, and especially our speaker. By way of context, for those of you who have missed the memo, the Dialogues and Research Ethics series is now in its 31st year. This is presentation number 209. Dr. Meslin is a repeat offender because he has joined us in the past, and for a number of reasons, it's a real privilege to have him back. He is director of the Council of Canadian Academies, which is, you will say maybe a little more about that and its analogs in the United States. But Eric and many of us met, well, it was back in the last century, wasn't it? As director of the LC program for the Human Genome Project, where you recall as genome sequencing was advancing, it became clear to a number of people that there needed to be an ethics component, and Dr. Meslin was the director of that. We later continued to collaborate when he was the executive director of the National Bioethics Advisory Commission, NBAC, as we lovingly called it, which produced some of the most important reports in the world, the history of human subjects protection, some of which we all still use and quote. Spent 15 years in Indianapolis, University of Indiana in Indianapolis, and we have stayed in close touch ever since. That's yours. Oh, that was yours. No. About that. What I've asked Eric to talk about, well, actually what he volunteered and I endorsed, was in an environment that we have, not just in the context of public health ethics, but all science in general and ethics, we have a great challenge related to information and misinformation. And on that note, maybe just say a little bit more about the council, because being Americans, it's probably something that we should learn more about. And with that, floor is yours. You have some slides, but we want to try and make it as interactive as possible. There are a fair number of people online now. Welcome to our colleagues who've joined us. Dr. Meslin, the floor is yours.
Well, thank you very much, Ken, and thanks to a group of high school students who've come in today, which is just delightful to have a group online, in the room, and elsewhere. I'm sitting at a long table, and I'll probably turn my head back and forth, hopefully not disrupting people's brainwaves. But I did want to not only thank Ken for his leadership here at the University of Miami I can't believe it's been 31 years of dialogues. We were both much younger then, as they say. But in some ways, if you were to go online and look at the history of the field of bioethics, and this is just a mini thesis I'm developing on the fly, and compare the 31 dialogues, the 31 lectures that have been given, I would predict that many of them would track some of the most important ethical, legal, and social issues that society has faced in the same amount of time. I wouldn't say that they are identical, but you could certainly find for any of the major issues that came along in health research, in biomedicine, in clinical care, in health policy, in public health, you would find many of those dialogues. So it's a delight, Ken, to be back here, both for your leadership and for your friendship. I've come up with a title, not simply out of the clear blue, but as you'll see in a moment, and if you did have a chance to read the abstract that I sent around, the purpose was to do a couple of things. One is you'd have to be living under a rock not to appreciate that the continuing impact of misinformation and disinformation. It's not a new subject, by the way. For as long as there have been people speaking, conveying information, there have been both unintended and egregious examples of telling falsehoods or lies or misstating the truths. And I'm not even referring to anything dramatic in the political environment that probably exacerbated some of this. So I wanted to pick a topic that had wide enough reach across not only the borders of the world, and in this case, Canada and the US, but to give it a bit of an extra oomph, because the organization that I currently work for, that I'll say more about in a moment, was asked by the government of Canada to give it an assessment of the state of play of this topic. What is the impact of misinformation on health and science? So not simply what are the ethical issues and what happens if someone tells someone something that isn't true, or they use that for political purposes, but how do we take that topic and convert it into a policy action? So a quick word, so that's the goal. I want to tell you about the topic generally, but in particular, I'm going to share with you the results of one of my organization's recent studies on this topic. So just a quick word about the Council of Canadian Academies, a bit of a mouthful. This is an organization that is not a government organization, but we call it arm's length. So it's an independent organization that is regularly asked by the government of Canada to undertake studies for it. And the studies can be on any topic. That could be on climate change, it could be on medical assistance in dying, it could be on marine shipping accidents, all around. And we did too on marine shipping accidents. That's not a humorous comment. They're all within the context of what we would call a kind of an epistemic sweet spot. And that is, what do we know about this subject? Like, what do we know? What is the state of knowledge on this subject? We don't go into lengthy discussions about what the government should do, but the goal is to assess the state of knowledge on this topic. What do we know? What don't we know? And then it may expand into other areas, like what are other people doing? What are the leading or best practices in this area? So you could almost treat the way we work as a menu for government who wants to establish a policy, either a new policy or revisiting an old policy. And it's always good to begin with facts, right? Before you start making decisions about what should happen or what shouldn't happen, let's at least know what we're dealing with. What do we know? Sometimes we don't know a lot, in which case we say, we don't know a lot. Do you still want to make a policy decision in that condition of uncertainty, or do you want to wait till you get more information? So the CCA has as its closest analog in the United States the National Academies, and in the United States the National Academies of Science, Engineering, and Medicine are one of the US's most, I think, precious resources. So National Academies, plural, refers to these three: National Academy of Science, National Academy of Engineering, National Academy of Medicine, all collectively called the National Academies. They live in Washington, D.C., in a beautiful building on Constitution Avenue. And they do, I was going to say, they do what CCA does. It's much more respectful to say, we built this organization in Canada. It's about a little less than 20 years old. The US version was created by Abraham Lincoln, right? So the National Academies in the US has been around since the 1860s, created by an act of Congress, and still to this day undertakes these studies where they bring expert panels together of individuals knowledgeable about a topic. They deliberate for often up to a year or more, and then present their findings, their results to the organizations that have supported them. In the case of, and I don't want to go into too much comparison because that's not the point of today's talk, but just so that you know, there are only a half a dozen organizations like this in the world, more or less, if you want to be really picky about it. And by organizations like this, I mean an arm's length from government organization that is asked by the government, sometimes even the private sector, to undertake a study, to pay for it, and then to let the group do the work. No meddling, no coming into the room, no asking to look at an early draft. So there's a little bit of a trust that goes in based on the credibility of the organization. And they do objective, independent, nonpartisan work. Okay, so that's the context. CCA has done about 70 of these. My last slide, which I'm happy to also share with you, and you can share it with your class for later, or maybe best to do it through the Institute of Bioethics, and that way you guys can share info and become good friends. All of the work is free, so you can download these reports at any time. They're French and English, Canada's two national languages, and you can read them to your heart's content and say what you want about them. So that's a bit of the background on CCA. I know for those online, you're seeing me, I'm kind of twisting back and forth, and I'm going to let Ken give me the high sign if there's a question that comes up. For those of you who don't know me, I will just keep going until I am interrupted or I run out of a breath. So if you want to ask a question, by all means, but I hope we'll have plenty of time afterwards. So that's a little bit of background on the CCA. You can learn more. We're not shy about talking about our work, but the point is not about us. It's really more about the topics and what we were asked to do. So we were asked by the government of Canada. Is there a way to move the side up to the top so that the people are not injuring my,
or minimize it altogether?
yeah, and hopefully everyone can still see me. Yes. So the way that our organization works is the government comes to us and says, we have a question. We don't lobby them and say, ooh, we want to talk about this, please ask us. They have decided that a topic is important enough to come to the CCA, and they come with what is called the charge, or the request, the referral. And as I say, you can take great notes. I will never tell anybody how to learn. All of this, the slides will be available to you, and all of this information's online. By the way, piece of evidence-based knowledge for you: people learn better when they're writing. Not when they're typing, but when they're writing. Very interesting. It's good to see all the people that you're writing stuff down. So we were asked these questions. It was called a primary question and 3 secondary questions. What are the socioeconomic impacts of science and health misinformation on the public and public policy in Canada? Now, that may seem like a very straightforward question, and it's intended to be straightforward. It's not meant to be complicated or nuanced. It's not like a deep science question about what happens on the long arm of chromosome 12 when you place it in an environment that looks like this. This is a public policy question, or it's supposed to help public policy. So it needs to be informative enough so that when you get an answer, you can do something with it. Not so abstract that it's uninteresting, and not so detailed that you're asking what's 2 + 2 and the answer is 4, and you say thanks very much for the work that you've done. There has to be some form of judgment and deliberation. And then there are 3 or more sub questions. I'm not going to read all of them. You can read over my shoulder and see what they are, but they relate to the impact of misinformation in various ways, the characteristics of misinformation. And then, as I mentioned earlier, what are the leading practices for dealing with this? Now, hopefully this is already stimulating you to think, I know exactly what he's talking about. We watch misinformation all the time. We're looking at it when we look at the news and people are talking about politicians, or we're reading about different studies that come out, and we don't know how to make sense of things. So that's the background. And the way that CCA works is we then convene an expert panel, usually of 12 to 15 of the best minds. They can be from Canada, they can be from other parts of the world. We had several that were non-Canadian, from the US and Europe. and they will be expert in a domain of activity. So there will be someone with legal expertise, ethics expertise, public health expertise, digital communication expertise. It's in fact, one of the fun parts of what we do is trying to figure out what are the areas of knowledge or expertise you need to have in order to answer a question like this. And I don't have to belabor this, but this is sort of almost deliciously ironic because we're talking about misinformation. And I will give you a quick spoiler. When we released this report just a few weeks ago, a lot of folks online said, well, of course, that's what they came up with. Look at those biased people that they had on their panel. So it was quite interesting. Unlike marine shipping, for example, you get the best people who know about marine shipping. No one's going to say, why did you pick this person? Well, they work in that field. But in an area where the topic is about information or misinformation, there's kind of a bit of a rabbit hole that's created. So that was the big question. One thing I just want to maybe emphasize one more time so that it's not lost is, unlike a question that says, what are the ethical issues, which is a very common way of thinking about bioethics. What are the ethical issues in end-of-life care? What are the ethical issues in doing genetic testing? What are the ethical issues, right? We do that a lot. Our field has spent decades trying to think of what those ethical issues are when, say, a new technology comes along. This is not a what are the ethical issues. This is a very particular kind of question. A question that's asked about socioeconomic impact, right? And the impact on a particular area, public policy. And the misinformation that we're talking about is in science and health. So we haven't talked about transportation or international trade or labor policy or whatever. This is, so it's narrow, but it's still obviously quite large. And it wasn't one of those, well, there's a bunch of ethical issues. That's not what the government wanted. The government wanted something that would help them make a policy decision. And I emphasize that not just for the high school students here, but for my distinguished colleagues online who know full well that oftentimes the bioethics community either gets a raw deal because all it does is come up with longer lists of problems without trying to solve them. Oh, you thought that was an issue? Let me tell you 3 more. And this is not that model. This is a public policy bioethics model, okay? So first, and maybe easy, most easily, but often itself a matter of discussion is what are we talking about? Like, what's the definition of the thing that we're about to go study? So this committee, realizing that after a fairly comprehensive literature review, and I have a staff of 30 researchers at the CCA, they have PhDs and master's degrees, and their job is to accumulate all this information, distill it, make it available to this expert panel, and together these reports are written over the period of about 18 months. So it's quite an intensive activity. This may seem either obvious to you or too simplistic, but if you were just to type into Google right now, the definition of misinformation, you'd find hundreds of them. No, I'm not saying they're all wrong and only one of them is right. So this group did what I would call a stipulative strategy. This is what we're going to be calling misinformation for purposes of our study. False or misleading information that is inadvertently or deliberately created or shared. Lots of stuff going on in there. We didn't refer to disinformation, which is a very important cousin of misinformation. Sometimes the difference is whether you're doing it intentionally versus accidentally. Whether you know that you're doing it versus you don't know. We didn't do that. This is enough to get everyone started, okay? So the background, like, why are we even talking about this? And again, using the rule of not putting too many things on a PowerPoint slide, the full report is available. You can read it, lots of info, and, you know, spoiler alert, PowerPoint slides should not be read and have long sentences. right?
They're very aware.
Good.
I'm a stickler for that.
I'm glad you are.
That's why they're laughing.
Excellent, good teacher. I can tell you a funny story about PowerPoint slides later on. But at the very least, and these are summary comments about a much larger a bit of material, it should be obvious to all of you that we believe in false claims because of the many avenues and methods of information being delivered to us. This transformed information environment, which is a shorthand phrase for everything that is accessible through something like this computer, which is more powerful than the computers were at NASA when they sent Apollo to the moon. And I know this because my father-in-law was one of those rocket scientists who did that, who was very amazed at this little thing, like, you can do what? So that's a shorthand expression. I don't need to go into detail. The volume, the speed, the pace, the platforms, it's overwhelming. It was once said that what was commonly known or generally known to the majority of Americans during Thomas Jefferson's time could have been collected in an average Sunday New York Times. Like, that's what one might say. That was the extent of knowledge that people generally had. Now think of how much access to information you have right now. I'm not going to say the word SIRI right now because she would give this lecture better than I would. And if I said ChatGPT, I wouldn't have to speak at all. It would just be up here. In fact, you might try later on. You heard Meslin give this really great talk on misinformation. Why don't you type in the question that we were asked by the government of Canada into ChatGPT and see what you get? It would probably embarrass me that it would be pretty passable. Probably not so, but not great, but a good start. Two other bits I won't belabor since you've read them over my shoulder. We are in an environment where phrase distrust, fragmentation, and polarization refers generally to the political environment. And I don't mean Republican, Democrat. In Canada, we have different political parties. It's not the world of political parties. It's actually the world of what people believe and where they get their information from and who they trust and who they don't trust or who they think they're not supposed to trust because their brother's, uncle's, mother's friend read about something in the newspaper that they got on a bus and therefore, right? So this has become quite a difficult moment in history. And I feel badly for you guys because when I say it wasn't always like this, Ken and I are in our 60s. I'm not going to age anyone else here, but I very much remember the time when these things existed, but at a lower level and not as dramatically. There's always been an information explosion, right? I lived through, when I was growing up, there were three or four channels on TV, you know, the major ABC, CBS, and NBC, and then along came cable, and there were a few more, and then. It's not hard to see the evolution of these things, but it's the speed, the pace, the timing. Same with distrust. People have always been distrustful of government, more or less. The interesting thing about this middle version or middle point about distrust is that it is now taken over the world of expertise. So there is a feeling out there, not universally regarded, but that experts themselves are not trustworthy. It's kind of a weird thing that experts are people who put on airs and who don't know the real world, and all they do is spend time in libraries or in their offices writing. They don't know the real world. Their expertise is so narrow that they're not real people. Now, that's kind of a weird feeling. How do you say, no, I'm not an expert? Well, actually, I am an expert. I have a PhD and I studied all these things and I wrote all these. So the idea that expertise is itself suspect kind of is a bit of a freaky proposition, because then how do you adjudicate between two different claims or two different assertions. It can't just be opinion or, he's better looking than he is. And I prefer people with, I think gray-haired people are smarter than people with brown hair. That's a scary world to live in. Well, it's a true statement, but that's a scary world to live in when you don't, it's sort of this race to the bottom of who gets to decide, and then who gets to decide who gets to decide, that infinite regress. And of course, that's what leads to, lots of the bottom line. Let's go to an authoritative source that you think is important, like, your faith tradition or something else. It's very challenging to try and adjudicate uncertainty. And then the last, nothing like a good crisis to come along, as they say, to help with policy. And the pandemic was tailor-made for this discussion, absolutely tailor-made. We'll say more about that in a bit. I noticed that there's someone with finger up with the chat, and although I can stop and take the question.
Yeah, so we'll wait.
Or we can wait. Should we wait?
Yeah, and as for neither of you see what the chat is.
I sent it to you, but yes, it's Dr. Ross, I sent it to you.
Should we wait or should we go? Hang on one second. Okay. How are we doing so far? Good. I'll use you as my.
Oh, so why not? This is actually from our colleague Jeff Roscoe.
Yep.
Does the fact that the information conclusion comes from CCA or NASAM rather than ChatGPT give it legitimacy?
Right. So who's that, Jeff?
Jeff.
So Jeff, great question. And I'm biased because I actually think there is a substantive, normative policy defensible difference between an algorithmic accumulation of knowledge and of a statement and sharing it, and the judgment that flows from a group of people having a deliberation. So some have mistakenly thought that the National Academies or the CCA or other groups, they get around a table, someone does a big lit review, and then everybody reads the big lit review and then says, okay, let's write what we found, which is sort of like a book review. I learned these things when I read. ChatGPT is a good consolidator, accumulate. It'll get better. It'll get much better. The more people work on it, the more, but it will never have the kind of, I think, the kind of judgment that we like to rely on. And here's I would say the ironic point I'll just sort of emphasize. When humans are doing this, sometimes they may be wrong. They may make an error. Their judgment may be imperfect. And in fact, that's kind of a good thing to know. And I don't want to borrow an analogy that I haven't thought through fully, but there's a debate going on in sports about whether we should eliminate all umpires, all of them. Just use the eagle eye. What eye is it called for tennis? Eagle eye, whatever. There's an eye for looking, is the ball in or out, versus the person who says it's out. Balls and strikes with baseball, big debate. Like, it's a strike. Like, why should we rely on this guy? And it's almost always a guy standing behind and making a decision. And this isn't one of those I long for this isn't a good old days argument. This is an argument for what it means when humans are engaged in an activity. It allows for uncertainty. It allows for different judgments. So, Jeff, I don't know if that fully answers the question, but one of the things I will say is that organizations like the National Academies and the CCA seem to have occupied a sweet spot where governments trust them to provide objective accumulations and judgments about evidence, and not to make judgments about the valence or quality of that to the point where they're making recommendations. Now, National Academies often make recommendations about the work they've done. CCA doesn't do that usually. So the decision making about how to make sense of this and what to do with it and how important is left to humans, meaning a legislature, a parliament, a Congress, and the like. So I don't know if that fully answered it, Jeff, but that's a start. Okay, let me press on. This is just a bit about the methods that we used. I'll be very quick, but very importantly, we did an analysis that distinguished between the impact on individuals, communities, and society, because they're not all the same, clearly. And we did something that is, I wouldn't say unusual, but was important and quite a value add for our work. And that was, we modeled, and we used COVID, as I said, nothing like a good crisis. COVID was the case study that we focused on quite a bit in this report on health and science misinformation. It could have been on lots of things, but that was the case study. We undertook a modeling exercise with one of our expert panel members from UNC, University of North Carolina. And I'll say more about that in a bit, that showed what the socioeconomic, meaning impact, was on different forms of different ways in which misinformation was used. Okay, so that's the background. Let me refer to the findings, and that's how our reports, our assessments always are presented. What were we asked? How did we answer it? What did we look at? What were the methods? Because as you know, the question that you ask will then determine the methods you use for answering it, right? In this case, we were asked, what's the socioeconomic impact? So we better have a method that can answer that question. If they asked us, what are the ethical issues? We would need to have a method for answering that question. So question was the most important aspect of any project that CCA does. And I would say in the world of public policy and bioethics, getting the question, when I say right, but answerable. I mean, it's not a good idea to have a question that can't be answered when there's someone who wants to make use of it. This isn't just a curiosity. I wonder why this is happening out there. And people say, well, there are a bunch of reasons why it could be. That's not useful. So the question drives everything when you're working in the world of public policy. And those questions could be those that I mentioned before. What's the state of knowledge on this? What's the socioeconomic impact? What are the leading or best practices? What are they doing in other countries? Lots of kinds of questions. So I'm going to give you a short version of the findings. And in the category, remember, we were looking at individual harms, community harms, societal harms, and then I'll go through a slide each on those, and then I'll show you what the model produced, and then we're done. So these were 4 categories of the kinds of harms or impact that this COVID-19 thing was producing that would result from misinformation, right? So remember, it's not COVID that's doing this, it's misinformation. Here are 4 of them. Illness, poisoning, and death from unsafe health interventions and products. If people don't understand what is being provided, or they think it's something and it's something else, those are demonstrable. When I say demonstrable, you can count the numbers of things, or you can model the number of things. Illness and death from communicable and vaccine preventable diseases. You can count the number. It's a very interesting issue in policy, and that is, you know what happens when you do something? It causes this. What happens when you don't do something? How do you measure what might have happened if you had done this thing, right? So in this case, one of the most interesting parts of the COVID vaccine misinformation dance was, how do you figure out how many people would not have died or would not have become ill if they had been vaccinated, right? So it makes your brain do some really interesting little dances. The money wasted on disproven products and services, people spending money, their own money, because they saw online that if you eat grapefruit seeds, snorted through your nose on a Thursday, it'll probably prevent COVID. Now, that's an easy version. I just made it up, but they were much more and many more serious sham, charlatan, proven treatments that were not proven by any stretch of the imagination. And then increased susceptibility to further and potentially more insidious forms of misinformation, the kind of gateway drug version of misinformation. If you believe that that the COVID vaccine causes this, and therefore that's why you're not going to get it, well, then maybe vaccines are bad generally. Forget about measles, mumps, rubella, right? Forget about any other forms of preventive health care. Because if I don't believe this, because my brother's uncle's friends, aunt's brother, whatever, said that they tried it and they got whatever disease, and you believe them, then what's to stop you from believing other things as we go down the road? All of these items are discussed in more detail in this report. Community harms. Again, I'm not going to read all these, but the point is, you will see that they are different kinds, right? They're not all injuries or physical physical effect on someone. If there is misinformation and people mistakenly believe that that vaccines are a bad thing, other vaccine preventable diseases might increase. It is a sad story right now that there is an increase in polio in the United States, or measles. It's beyond understanding to me. Just that we've known about this, it works, and there are people who are questioning this on the basis of nothing other than misinformation coming in. Vulnerability is especially important in marginalized communities who may not have access to, and this is not just Canada has a better healthcare system than the US. This is not an argument about healthcare systems. This is an argument about access to those who would, irrespective, have to pay higher costs, whether in money or time, to get to see someone. So think of all the other, as we say, knock-on effects on health prevention, disease prevention, health promotion as a result. And then again, the version of that trust-distrust of polarized and aggressive public discourse. And I don't think I have to tell you that it's not just Facebook and Twitter and the usual platforms where people find it's a lot easier to be really mean, to be very aggressive, to hide behind their Twitter feed, and to start without impunity doing some pretty dangerous and frightening things. And then lastly, because community and society is not the same thing, we could spend more time talking about the difference. These broader societal harms, again, using that same rule of not putting too many things on a PowerPoint slide, but it goes all the way from, there are other areas. If we don't think the government is acting correctly on vaccines, why should we believe that anything they want to do for climate or immigration or gun control or the list, like put it all in one bucket. We don't trust folks because we read it online, and our society is going to be in deep doo-doo. I don't think I have to tell, it's a technical term. I don't have to tell you that for the first time in forever, US life expectancy has declined over the course of the last 3 or 4 years. An unimaginable outcome that in one of the richest countries in the world, despite the great division in the haves and have-nots, people live on average less for a less long, fewer years than they have just as recently as 5 years ago. So lots of potential societal harms. I do want to just do a bit of a shout out to the item on the lower left, which begins with lower public trust and civic engagement. Among the unintended consequences of all this is, you know what, I can't do anything. Like I don't want to listen to anything anymore. I don't trust anybody. No offense. I don't trust experts. I don't trust the government. I don't even trust my brothers, uncles, friends, whatever. I'm just gonna put a pillow over my head, which means I'm not gonna vote. I'm not going to write to my congressman. I'm not going to study more. I'm not going to read more broadly. I'm not going to have conversations. I'm not going to Thanksgiving. That's for darn sure, because, you know, Uncle whoever, I know what he's like, and you know what he's like. So I don't want to discuss politics. It's a bad subject. I don't even want to discuss the next election. I don't want to discuss anything. And that has nothing to do with, that's not a COVID issue. That is a result sort of twice removed of all of this. I just, hands over ears means that scientific literacy, civic literacy, any other form of engagement is just gone or leaving. And that will have long-term implications well beyond the time after everyone's been vaccinated or not, or whether it becomes an endemic rather than pandemic disease. And just like our flu shot, which not everybody gets either, and they should, especially when you're older, you know, hopefully we'll get to the point where everyone gets their annual COVID shot. It's the next thing you get, no big deal, move on. We're not there yet. We may never get there. Okay, quick word about the modeling. So I'm not going to explain in great detail, in part because models require lots of explanation. How did you do this? What was the point? How did it work? But this is meant to summarize in unfortunately, a little bit complicated slide, something that's even more complicated. And we wanted to look at the behavior of people. Behavior has a U in it because that's how they spell it in Canada. Under three different scenarios. One scenario is what we call the hoax scenario. One was the cover-up scenario. And the third was the if everyone were vaccinated. So just so you know what happens, the modeling, and this is a mathematical exercise to try and come up with some numbers, and I'll show you the numbers in a moment. If the proportion of people who agreed with the statement COVID is a hoax and or exaggerated, if the number of those people who believe that, and we know that there are a number of people who believe that, if they had been vaccinated as soon as they became eligible. So pretend that the people who believed in hoaxes didn't get vaccinated, they actually got vaccinated. What would the numbers look like? Scenario 2, vaccines cause many problems that were covered up. There are people who believed through misinformation that, you know what, those vaccines, there were problems over here and problems over there. Nobody wanted you to know about them. They wanted to get everyone vaccinated. That's another reason why people didn't get vaccinated. The first group thought it was just a big hoax, a big cover up. The other were, it's not that I disagree, but there are things they aren't telling us. They aren't telling us. So what would the numbers look like if that group had gotten vaccinated? And then if everyone in Canada were vaccinated as soon as they became eligible. It's a true statement that many, many more people in Canada have been vaccinated than in the United States, but not everyone. Like we have an 83 or 84% of Canadians have been vaccinated at least twice. Those numbers are much lower in the US. But pretend that everyone who is eligible, okay? That's the basis of the modeling. Let me just give you a quick version, and that above the top of the slide says costs. I will read this, so it's hopefully slow. When I read it slowly, not because I can't read fast, but so that you get it. Under those three scenarios, the case numbers of COVID would drop by 22% for the no hoax scenario, meaning if those who felt that it was a hoax had been vaccinated, the rate of COVID would have been reduced by 22%. There would be 22% fewer COVID cases if they had been vaccinated, the hoax believers. 25% for the no cover-up scenario. And 29% for the full vaccine scenario. So those three groups who had their own reasons for not getting vaccinated. One was, I don't believe it's a thing at all. Secondly, they're not telling us stuff. And the third is, I haven't gotten around to it. I'm not sure if I want to do it. I believe in them, but I just haven't done it. Look at the numbers. Bottom line, when we converted all that cool stuff into money.
This is Canadian dollar.
Canadian dollars, which is about 76% of the US dollar right now. But real money, real money.
For sure.
Misinformation is estimated to have cost the Canadian healthcare system at least $300 million in hospital and ICU visits. Those people who weren't vaccinated for any one of those three reasons cost the healthcare system $300 million.
Is that including the cost of vaccine to vaccinate?
Yes. Now, there's a little clause at the bottom of the slide. It says this excludes the cost of outpatient medication, physician compensation, and impact on non-COVID care or long COVID. So this is an extremely conservative estimate, very conservative estimate. It could have been much higher. And this isn't a health economics class. So I don't want to go into all the details of how the Canadian healthcare system works and what gets reimbursed or doesn't. The take home is a lot of money, right? A lot of money. And that's what politicians will think about. They'll also think about the number of people who may die. So let's look at some of that. This is what I call the elevator pitch slide. The one when you want to talk to somebody, and it's a silly metaphor, the elevator pitch, because no one ever said, it's supposed to be, you get into an elevator with a politician, you only have a few seconds to make your case. Well, no one's ever said how many floors you're going up. I mean, if you're going up to the top of the Empire State Building, you may have more time. If it's just one floor up to the mezzanine, less time. But here's the quick pitch, which we've also produced as a one-page handout for all politicians. It's not just a big thick book with lots of appendices. It's one page. 198,000 fewer COVID cases, 13,000 fewer hospitalizations, 3,500 fewer ICU patients, 2,800 fewer deaths, and there's the 300 million or so. So if you're a politician and you read that, I think, and hopefully most reasonable people would think, that's important information that I didn't know. I've been reading about COVID and people having views about vaccine. That is hard data. So let me just finish that. Again, sorry about the chat stuff. And there's someone on chat, Ken. I don't know if it's coming up. Okay. I think this may be the last slide. It should say leading practices in assessing misinformation. And these are 4 well-known evidence-supported practices for dealing with misinformation. Prevention. Welcome, you're now in a prevention mode, this actual class. Debunking, which is when someone says something, you don't just let it slide and say, well, yeah, that's their view, I don't care. There's an intentional action of correcting falsehood. Communication, making evidence readily accessible, tailored to different audiences. And this second bullet under communication is extremely important. One of the things that I don't have time to talk about now, but maybe in the discussion that follows, for which we have about 9 minutes in a minute, is the way science works is that it's quite normal to say, this is what the evidence tells us today. And then I've learned something new, and now I have a different view. I've got more data. Now, that's not flip-flopping, as people might say in politics. That's doing science. That's gathering more information. I may be uncertain about this right now, and I'm going to tell you, this is what I know, and this is what I don't know. by saying this is what I don't know, it doesn't mean I don't know anything. It means this is the limit of my knowledge now, and I would like to learn more. And when I learn more, I will tell you about that. And that's often hard for people who think only in black and white. You know, the old, I just read that red wine is good for you. Oh, there's a study that said red wine is bad for you. Science is stupid. It can't decide whether red wine is good or bad. That's not how science works. And then resilience, teaching critical thinking in all aspects of this. So look, I'm going to leave it. I've given you our website, as I said, free of charge. The title of the report is called Fault Lines. I've mistyped my own name, which is bizarre. It's Meslin. That's very funny. There it is. So 10 or more minutes, Ken, and you can facilitate the chat or the yeah.
So you remember, so when I
want to go back?
my surname is Goodman, and when I have a typo in it, it comes out as goddamn, but that's another story altogether. Thank you very much for a wonderful presentation. What I want, there is one question, Sergio actually is that question, or raised the point. This is by way of some context. Misinformation of one sort or another, especially surrounding vaccines, has been percolating for a while. Sergio mentions the famous paper in the Lancet, a very important English science medical journal, by a guy named Wakefield, who published an article that seemed to associate ordinary vaccines with autism. Now that's false, but a major journal published. It turns out that he was irresponsible in his reporting. He actually published an article to try and get people to have a false belief. And then the journal, when it found out about it, took a long time to correct it. So Eric, in that context, in terms of debunking, in terms of your conclusions, what would the council say is our next step? Given we have stakeholders here, we have journals here, we have governments yonder, we have academics, and we have ideologues who are trying to put their thumb on the scale.
Yeah, it's the short answer, and Sergio, great reminder about Andrew Wakefield. The only the quick answer I will give is debunking does not have the same power and will never have the same power as the original claim. Right. So in the old days, when there was an article in a newspaper about something or someone that happened to be accidentally incorrect, the name was wrong, the survey was wrong, whatever, what you would see is a day or two later, a very small correction box, 3 pages in, buried under the, right? No one would ever see the correction. The paper did, it wasn't so much debunking, they were correcting the error. So we're now even, right? There was something said over here, it was incorrect. We've now said what is correct, all fair in love and war. Well, clearly not true. There's a first movers argument here, which is whoever gets to make the case first, and they keep making it. This is why, and it's the only time I'm going to mention the former president here. One of the things that Donald Trump did and has always done is said the same thing over and over and over and over and over and over, whatever the argument was, which is very hard to, you can't either debunk or go back. He said it 24 times. Do you have to say he's wrong 24 times, or just say it once and hope that that will equal? So the idea of debunking is actually not something that I think that journals are responsible for, but everyone else who makes use of that information. Journals have a particular responsibility, and they also have limited powers. The powers are to retract a paper, which they can do, and retracting a paper is a big deal. They could launch a misconduct investigation. If this person published information that was wrong, materially wrong, there are many things that they can do in the academic world. But it's not that I don't think that journals have that responsibility, but I'm at the risk of sounding curmudgeonly. The world of journals is a very rarefied world where experts get to write papers and have their other experts judge whether they are good enough to put in a journal that will be read by people, not the world, but by people in their field. So I guess I'm sort of hunting a little bit on your question, Ken, only because I don't think that the source of the Wakefield debate was a journal many years ago. We have now moved on so that it's not just journals. You can publish in non-peer reviewed journals. You could publish preprint. The idea of peer review and what the Lancet's responsibility is now being sort of overtaken by how we even think of what the role of journals should be.
But you can see also, and you may be able to scroll through those on the right.
Oh, that's me. Okay, great. Yeah.
And in the interest of time, you'll be able to look at it quickly and see whether or not you want to respond. You haven't said the word ethics but once or twice, but one question that might be a reasonable one to ask is, why would someone willfully or intentionally create or spread misinformation to the detriment of the Canadian people?
Yeah, so this is, and Jeff, thanks for your follow-up as well, because I also agree that, you know, when Richard Horton said this was a big problem, I don't disagree at all with any of that. I guess I would say that why would people do that? If I knew the answer, we wouldn't have to write. We wouldn't have to write the paper. On the other hand, we did give an answer. Why do people do it? Sometimes it is unintentional. I mean, things happen. In which case, the responsibility, moral and legal, of the person who learned that they unintentionally, mistakenly released some form of info would suggest that the ethical obligation is not only on them, but on the community of which they are a part to say, you know what, you let this info out there and it's harming people. Oh my God, I didn't realize that. Let me do all that I can to correct that.
And that is an argument for intellectual honesty.
Well, and it's also, yes, it is. And it's also the point raised earlier about admitting uncertainty. That there's absolutely nothing wrong with saying, I was wrong. Not, aha, you were wrong. I knew you were wrong. I'm never going to trust you again. Somehow that switch flipping from admitting uncertainty, admitting a certain amount of humility, this is what I know. This is the best that I know at this moment. We've kind of lost a bit of that.
I think we need, in the interest of people who must move on to something else, to therefore say, Eric, thank you so very much. Thanks for coming. Thank you for another. The greatest hits in dialogues and research ethics is going to be out soon, I hear.
Yeah.
But you've done this and talked us through one of the most engaging, challenging, controversial issues of our time so nimbly. Thank you so very much.
My pleasure. Thank you. Thank you for all online. One new method. Let's just see if someone said something nice. Yes, thank you. Thank you, Jeff. And thanks to everyone else for joining online.
Thank you.
Would you mind if we could get a picture with the two of you? Would that be okay?
You don't want my picture, do you?
Yeah, I do.